care, which they can get outside Nigeria. They can easily put themselves on the next flight to Italy, the next flight to Germany, the next flight to the UK, and get access to quality health service. The poor cannot do that. And so one way of ensuring that healthcare is available to all, good education is available to all, affordable utilities are available to all, is to ensure that government provide public service. And in this case, we are talking about quality public service. If you look at Nigeria, if you look at the other part of the continent, other countries in the continent, that is how citizens sustain themselves. I can imagine the number of people that are employed in the public service in Nigeria, those that are employed in the public service in Ghana and Africa. Imagine the level or the number of employment opportunities it provides for our brothers and sisters, our families, our mothers, and our fathers. Imagine that it is completely wiped off, like the way some politicians are advocating for, a complete wiping of public services, putting everything in the hands of the private sector. And if you're a Nigerian, you can understand that it is actually a problem because of how the energy subsector in Nigeria has been managed by the private sector. And so what this means is that you and I have an opportunity to jealously protect and secure public services and the public sector in our various countries. We have that responsibility. We owe this responsibility to ourselves, to the generation unborn, and to society in general, that it is only through public services that each and every one of us can have access to quality education, quality healthcare, quality roads, and every other aspect. In fact, if you follow how private institutions establish in various countries or invest in various countries, first and foremost, one of the things they look out for is establishment of strong public institutions. Without strong public institutions, the funny thing is that private enterprises or private individuals will not invest in any country without strong public schools, quality public schools, without strong healthcare, without strong good roads, without strong or strengthened public financial sector, without strong rules and regulations, without strong judiciary. No investor would want to invest in your country. So on the contrary, some of them advocate for a complete distraction or a complete removal of public services. It's actually public services that sustains the private sector in our various countries. However, there are a number of challenges
Daniel,
that yes, I know my
sorry,
time is up. Just one
20
more minute.
seconds.
There are a
Thank you.
number of challenges that public service provision faces. One of them is revenue mobilization, and that some of my colleagues will get the opportunity to share more on that. The other is corruption. And then the last one is also perception. So, for example, it is common for politicians to say that our public sector wage bill is huge. And so, one, we want to stop employment in the public service. And two, we want to keep wages at a certain level. The other perception is what we call efficiency. And the word efficiency has been used over the years against public services, against public sector workers. Again, once we start discussions, we'll get the opportunity to analyze all these things. And so on behalf of myself, the Public Services International and our affiliates in Nigeria, who are basically the holders of the system in Nigeria, I want us to welcome this session and welcome everyone and introduce the next speaker for this session. Thank you very much.
Thank you so much, Daniel. That was definitely on point. And I will make the presentation on the study that we commissioned in Nigeria and other countries. But today I'm just going to focus on the Nigerian results. So I'm going to share my screen. I hope, yeah. I hope you can see my screen. Okay, great. So the presentation today is about the perception of public services in Nigeria. And as I was saying earlier, it was very important for us to kind of ground our advocacy. Let me, please make sure your microphone is off. Okay, thank you. So what I was saying earlier is that it was very important for us to ground our narrative, our advocacy around the importance of public services in various countries. Because again, you can't speak on behalf of people if you don't hear from them. So what we did is that we partnered with a survey company called Lexia, and that company started conducting some surveys in several countries in Latin America, in Nigeria, and in India. In Latin America, that company conducted some sessions in 4 countries, Mexico, Colombia, Chile, and Guatemala. In Asia, it conducted some sessions in India, and in Africa, it was only in Nigeria. I would like to start with this disclaimer by stating that the results of this survey are not meant to necessarily say that this is the overall picture in Nigeria. Not at all. It's just to get the perceptions of the few people that were interviewed, because it's a qualitative research. So we focused more on what the people had to say instead of how many people were saying something. And we want to use the results today to trigger reactions from you, so that you also share your own experiences regarding healthcare and education services. So the sessions that were conducted online to gather data. In Nigeria, it was conducted, I think, in January 2024. And move here. The objectives of this study overall that happened in several countries, including Nigeria, was 1, to explore the associations and meaning of public services for people, because perhaps what I mean when I talk about public services may not mean the same thing to you. So it was very important to clarify this first. Secondly, to understand the perception of the involvement of the private sector in these services. But, I mean, the questions that we were asking was that, how do you perceive, let's say, private healthcare compared to public healthcare, or private education compared to public education, etc.? Again, the study aimed to identify myths and popular beliefs existing around these public services. So in this case, even going beyond personal perceptions, but interrogating the collective, the way everyone may think, I mean, what we think when we hear about public services. And another objective was to identify disparities and barriers in the access to these services, country by country and by specific conditions of individuals. So I guess this one is self-explanatory. And finally, identify possible messages connecting with people and promoting the agenda of public services. So again, this was for us to better inform our advocacy on the ground. So there were various interesting results that came out of this survey, these interviews. So we have general results that cut across different, like all public services. So education and healthcare all put together. Then we'll have specific results that relate to each health and education. So coming to the cross-cutting or general results, with some exceptions, most people perceive public services not as a right, but rather as a benefit or privilege for which they feel grateful. So the few people that were interviewed, they did not think that public service was a right, or accessing good education, good healthcare was a right to them. For them, it's a privilege. It's not their birthright. The second one is that the expectations people have of public services are generally low, particularly compared to expectations regarding private facilities. There are some quotes that illustrate those results, but in the interest of time, I'll move to the second cross-cutting or general result. In private services, payment is the tool that allows people to demand quality. So it means that if they think that public services are given to them free, they don't expect to demand quality. For them, it's only when they pay that they can expect quality. And there is also that belief that free things may be inherently worse. Interesting. Let me know what you think. General results, again, highlighted the fact that people think because they pay taxes, so that's the main reason they have, or they can demand, they are legitimate to demand quality and availability of public services. So at first, some people were like, because I don't directly pay for those services, I don't think I'm legitimate to ask or demand quality. Then there was a follow-up question, but you do pay your taxes. They were like, yes. Do you know that those taxes are used to fund those public services? And that's where there was this haha moment. They were like, oh, okay, because I do pay my taxes, so I think now I have the right to demand quality. The idea of citizenship and universality also appears, but to a much lesser extent. Then another result was that in most cases, the interviewees recognized the difficulties that health and education professionals face in public services. That's very true. And they recognize the need for those professionals to be paid better, to get well paid. Another result is that people recognize that there should be more funding for public services. And finally, I think in terms of general result, there's obviously distrust, lack of trust in the government due to corruption, and the fact that campaigns promises are not kept. Sorry, before I move to the specific result, the last one is that there's a perception that public services will be improved with more oversight. So, for example, there is someone who said that not all government hospitals are bad. Maybe the bad ones were not always inspected, and they act anyhow they like because there is no supervision. So the issue of monitoring and accountability was something very important to the interviewees. When it comes to specific results, especially regarding healthcare services, we found that some people think since access to health services can be a matter of life and death, people rate deficiencies in these services more harshly, obviously. If you don't provide quality healthcare to someone, the person may die, and this is an irreparable harm that can't be redressed. So of course, people are more no-nonsense takers when it comes to healthcare services. And the main complaint relates to the long waiting times and lack of capacity to treat medical emergency. Let me know whether you have a similar experience. Another result related to health is that doctors in public hospitals are harshly judged. So someone said, for example, that the medical professionals that the government are employing lack empathy and emotional intelligence. If you go to the hospital, they speak rudely to you. Let me know what you think. Someone also said that the government brings drugs to hospitals, and most of those doctors will steal those drugs, take them to private hospitals, and refer you to go them to buy those drugs from them. Another result is the centrality, and that's very interesting, the centrality of community and traditional medicine. Everybody prefers to drink their agbo, perhaps, instead of going to hospitals. This is an interesting finding that came out. And then in terms of education, that's the specific result now relating to education. What people value in private education or private schools are smaller classrooms, quality teaching, and better access to technology and learning proper English. People think that in public schools, teachers speak Pidgin English or sometimes Yoruba, for example, in Lagos State. So that is a problem to them. Another result regarding education is that the deficiencies in these education services are rated somehow less harshly compared to health. Less harshly as people believe that it is a responsibility of parents to educate their children primarily. So overall, to conclude, what people think of public services is mostly based on their own experience, obviously, using those services. People know and recognize the main aspect they would like to see improved: faster access to healthcare services, for example, smaller classrooms, and they acknowledge that those services are really important. People are quick to praise and recognize when public services improve because we obviously will all need them. And taxes that we pay are seen as the main reason to demand better public services. But people don't always recognize indirect taxes as much, or they don't even recognize that it's their right to access public services, whether they pay for it or not. And of course, rights don't usually appear as the foundation of the demands. So I will stop here and I'll give the floor to Zikora, who will moderate the next session. Thank you.
Thank you so much, Aya. I think that was an interesting research, and the findings are quite eye-opening, although not surprising. So at this point, I think where we are now is the point where we share our experiences to also note if what the research findings has exposed are what are our realities. Indeed, people's perception of public services are quite aligned with how they experience them firsthand. So, and that is what this research has exposed. So, in case you want to share some of your experiences in terms of how you have perceived or how you have received public services like education and healthcare, you can use the chat box or you can use the identification icon, and so it would allow you to speak. The floor is open. So do you think that what people have said in this research are true or are false or are not? And what are your experiences really? This is what we want to also know at this point. Um, how have you received these services in Nigeria? So the floor is open. So you can also comment on the general findings. If you have questions, if you have reactions, if you want to say something so that the researchers can take into, can accommodate extra information from anywhere. I see somebody used the love. That's for you, Aya. But if anyone share anything, the floor is open right now. And this is just to say that it is, like I said, it's not surprising what the shift has been. And from the research findings, people have said, oh, look, I think that you need to pay for you to get quality services. And this is because over time, the ideology in terms of the provision of public services has shifted. And when these services are underfunded, really, the kind of quality you get are not exceptional. And then it also impacts on how people perceive them or how they are given to people. So, and then when people get a better alternative, not better in quotes, because sometimes it's not really better, but something slightly a bit improved from what they see in the general service environment, it seems like, oh, paying for it is much better. But should this be the case? I think these are some of the discussions that we can also have. Should this be the case that payment validates quality? I think that's a question that I want to also ask ourselves. Should payment validate quality in terms of the provision of basic services like healthcare, education, water? Ahmad Shehu says that the findings was really through. I guess it's something that relates with you, Ahmad. So someone on the chat box says that the finding is really through. Yeah, to some certain extent, yes, it is true. And there's also that argument. I think it can also be an open question that we can think about why we also wait for people to react or to also share their own experiences. There's also the argument oftentimes that public the management of public service when it is hosted under public management or democratic management is often not effective. Okay, so Abdul Kadir Yusuf said to some certain extent the findings are true. Yusuf, if you want to also expatiate further why, to some certain extent, the findings are through, the floor is yours if you want to talk more about it, and also just give a quick intervention on what you think. So while we wait for you to also explain further, because I would like to understand to what extent the findings are through and to what extent the findings are not through. And so I was saying that, oh, Daniel raised his hand.
This is Gideon. Okay, I'll wait for
Right.
Daniel. This is Gideon. I wanted
Gideon,
to.
okay, Gideon, please go ahead.
Okay, okay. Thank you so much for the presentation, and thank you, Zikora, for the moderation. I just wanted to chip in that I think people's perception of public services is also a function of uh, what we are fed with over time. I mean, through the media, through some other institutions, maybe our religious institutions, all of our socializing agents, we are at a time when there is a very radical campaign, I would say, by the government particularly, and of course, international financial institutions like IMF and World Bank and co, trying to prove to us, trying to disorient the people to accept that services have to be privately run, that government, they will say government has no business in business, just trying to prove that uh, government cannot successfully run any of the services, basic services that we need, be it water, be it education, be it healthcare. And I'm speaking as someone who has also had very direct experience and done a bit of research, working on the water desk of Kappa. Uh, we hear it on radio, we hear it everywhere. They saying that government cannot successfully run these services. Whereas we know from experience, when I was growing up, I used to say water was publicly run, and on almost every street in my village, we had public water, and then the structural adjustment program started taking root, and government stopped. I mean, government investment started reducing in water, for instance, and all of these services. And so definitely the private sector will come in. They begin to provide water in sachet, or let's stick to education and healthcare now. They begin to provide they begin to build private schools. Many of the private schools that have no playgrounds, many of the private schools that have no school farm, that's the kind of private schools that we have now. And then you now do a rating of the private schools. Has government investment in education start reducing, the quality of public education starts getting worse. Then the private schools start providing alternatives that are not as good as what public education used to be. Public schools, when I was growing up, public secondary schools when we were growing up, had more than enough space for gardening, for playground, for just name it, all sort of activities that we hate children's, young people's development. But the private schools that we have today don't even have enough space for all of this. But because when they now do ratings, because the public education institutions are in uh, very terrible states now, when ratings are done, you now see some of these private schools ranking higher than these public schools, and then they now use that to say, you see, when services are privately run, they do better than publicly run services. Whereas globally, when you check the ranking of our universities, for instance, while a private university may rank first in Nigeria, the private university has no ranking globally. I mean, the rank is very low. Just to tell
Thank
you
you,
that,
Gideon.
okay, ma'am.
Thank, thank you
All
so
right.
much. Thank you. I think that
But
was an
let me just
important.
conclude by just saying that it's a bit, all right.
Oh no, Gideon, you could conclude in 30 seconds.
Yeah, so the basic point is that when they underfund public education, private sector comes in, provides something of less quality than what we used to have, but which is now better than the public services, which are now in very poor state, and then they use that to justify. We should just refuse to accept that argument, that narrative. Thank you very much.
Fantastic, Gideon. I think that's an important perspective, and it links just to what I was trying to say before your intervention. Thank you. I'll just read a few of the comments in the research in the chat box, and then go back to the persons whose hands are raised. So in the chat box, Amina says that this is a very good research, but government should be following what has been given and doing accountability. And then Mohammed says, through to some extent, especially the issues that has to do with rudeness with some health practitioners to their patients. And I think somebody loved that comment. So it's quite a very pervasive reality in Nigeria. So Ahmad says he wanted to highlight something. Ahmad, please feel free to raise your hand and you will be allowed the floor to speak. So Daniel, please, if you could make your intervention, and then George and Ahmad.
Yes, thank you very much to Aya, and thanks to the previous speakers or previous commentators. And picking from Gideon's point about underfunding. So what you see is that there's a high expectations from public services and public sector workers, by citizens. However, there is lack of funding. And so instead of focusing on the challenges these public sector workers, the challenges we face in our interaction with the public sector workers, I think we have a duty to demand that government provides funding for public services. Because you can't set up schools, you can't set up hospitals, you can't set up public institutions and not fund them. And so you and I have a responsibility to ensure that while these institutions are set up, government also puts in place mechanisms to fund them. And one of them is to ensure that resources are mobilized. And that also means that government has to reduce the number or the amount of tax incentives it gives to multinational companies, including certain big politicians in Nigeria. What it also means is that if you look at, for example, the special economic zones, how much revenue goes out of the system because of the incentives that are granted to them. When companies are found guilty of tax evasion and tax avoidance, we must demand that they are dealt with by the law. Once we make sure that we put a demand on revenue mobilization and expenditure, then we are creating space for enough resources to go into funding of public schools or public healthcare or utility or water. I can tell you there are some of these public sector workers like our nurses. Of course, we have all faced our own, we have all had our own experiences when it comes to the attitude of nurses. But what we have to bear in mind that some of these guys are working under very strenuous conditions and systems. And so it contributes to affecting them. In fact, some of them are working in these conditions and are providing services not just in the public hospitals, but also do what we call locum. And I'm sure you're all aware of that. So we must pay attention to this. Let's also understand that private sector is profit driven. And so whatever measures they will put in place to extract as much profit as possible, they will do that. There's no two ways about it. Public sector is not a profit-driven organization. Just like Aya said from the beginning, you are paying your taxes, government has a social contract with you, and they must provide all these things. And that also means that we must not leave the policy space only to government. We must engage all the policies regarding education. We must engage all the policies regarding healthcare, regarding utility, regarding every public service in our countries. If we leave it to the politicians, they will do it as they wish, and they are going to use that for the purposes of elections. And so, for example, you find that they are constructing certain roads only because they are few months to elections and they want to win the heart of the people and get some votes. So we must all be involved. A point Gideon raised again about institutions that are contribute to the kind of perceptions we have. You can imagine that it only became possible for Nigeria to privatize energy because at the time there have been a strong narrative against public sector workers and against public services. It doesn't happen by chance. Some years back, it happened in Ghana. Thank God we've been able to fight back. But the point is that before those initiatives are moved or are granted, there's a deliberate effort to launch a public disincentive against public sector workers and against public services. And so by the time they talk about privatization, easy peasy, it goes in and it goes through easily. So I think that we must pay attention to some of these contexts. Thank you.
Thank you so much, Daniel. That's quite important, yes. George. George, you can speak.
Okay. Good morning. Can you hear me, comrades?
Yes, please.
Okay. So thank you very kindly. Actually, the research was a very good job, and I think the results are quite in place. And these are things we all need to look at. And I think they are cross-cutting. It's not just limited to Nigeria. But most of what I wanted to say, Comrade Daniel have just spoken to. So let me just add a few points to what I had listed already. Now, when you look at what has come out of the results of the research, you realize that there's a huge gap of people knowing their own rights in regards to what they are supposed to have from government, as in social contract that brings a government into power. When we vote for government, what it means, simply that we are telling them we want better hospitals, we want good schools, and those kinds of things. So we are voting you. So in return, you will give us quality lights and good roads and all of that. And until we can take that mantle as civil society advocates to make our people to know that these are their rights and not just a favor from government. This will always be the case, that people would think if they pay for, they should pay for health care when government's supposed to provide health care. They would think if they don't pay for education, then the education is not valid. Because this is the narrative of the corporate world, selling their brands, that a Samsung phone is expensive, is better than a Nokia phone. That is the same perception that what people carry to public services. So if they didn't go to a private hospital, do what you can, they would think they didn't get a good treatment because it is in a public hospital that is maybe free of charge or is less expensive. So we have a duty to educate our people even more. The next thing we have to look at is when they talk about how unruly health workers become in the public sector or even in the educational sector. Comrade Daniel spoke to it in detail. So I just wanted to add that it is the overload of the work that these people are doing. The burnout that comes with it sometimes lead them to be the way we see them when we go to the hospitals or to the school. Whereas in the private sector, they are now overburdened with so many clients, as you will see in the public sector. Go to any public school, you will see so many students in one classroom. But the question is, the people will always say, do we not admit the students and allow them to be roaming out there? But the real thing is investing more to create more rooms, more classrooms for more students, instead of bundling them up. So these are things that we all need to understand, and the layman needs to understand so that they are able to proffer the rights.
Thank you. Thank you so much.
Thank you so
Thank
much.
you. Thank you. Thank you. I think we have such and I know our time is almost up, but please allow me to read some of these interesting comments in the chat, which are quite expository. Mohammed Odu says that through to some extent, the health practitioners are always rude with their patients. And somebody else said how some of the health practitioners use government equipment for their private businesses, which is something that the research also flagged. Gideon Adeyemi says another way to ensure that there is funds for publicly run basic services is to reduce the cost of governance and resources expended on destructive activities like wars. I think that would also come when we begin to rethink of how we can reclaim ownership of public services. Ogunlade Olamide says here, my name is Olamide Martins. I work for Kappa. Here is my story. In the year 2020, my wife waited 3 days on the admission bed in a public hospital to deliver our first child. From Friday 10 p.m. till Monday morning around 2 p.m. The doctors won't just be available on weekends, and our fate was decided by medical interns. Almost too late to consider second opinion. In rounds, the young inexperienced interns will come with their files and take academic writings. Oversight was lacking. Quality control was close to zero. I filed a petition against the supposed teaching hospital, but my letter wasn't treated, nor was any invitation extended to me. I think there is a lot of rot in the public sector. Inefficient management, absence of performance checks, skill gaps, and corruption, of course. The public sector has become an option, a distant thought, I would say. We need to invest in human capital and emphasize on citizen centricity in the public sector, or the status quo will remain the same. I agree with you, Olanda, and I'm sorry for your experience. Ayodele Aduwo says the need for citizenship education cannot be overemphasized. That citizens rarely know what public services are, tell of how much they know of themselves and their place. I think there is a vacuum of knowledge about tax education. Comrade Enoch says that the research is quite strict. I want to add that we should be careful in selecting leaders and should have people that follow up all the leaders to know what they are doing with the budgets. Mostly the general environment where public services are working. And the final comment from Atat House says, I believe the main problem is citizens' lack of knowledge of their rights, and most times don't trust to use the system. We the people are the problem because we are the government. I guess we can agree with that partly. To my own perception, government, this is coming from Ahmad, to my own perception, government and healthcare givers are not the only sector to be considered in delivering quality public services, but rather there are some intermediate personnel that are also important in delivering quality public services. The patient did not meet the healthcare giver first, but okay, I think that ended incompletely, but he's trying to say something. Yeah, I think we've had such a wonderful overflow of experiences and how people perceive public services to me. And I think what everybody has said is quite important. One thing that struck me most is the narrative. I think narrative is the big deal, because there's an onslaught of diminishing narratives of whether government should indeed be responsible for providing public services. And there's that dominant story that says that government has no business, like somebody has said, in provision of public services. And when government gets involved in the provision of public services, that public services die. They can't manage it. But one thing we should be asking, is this true? And particularly in the context of Nigeria, all the times we have been told that government has no business in public services, and public services like electricity has been pushed to the private sector to handle. Has it translated into anything meaningful? Which now brings us back to one of the findings of the research in terms of how people think that these services should be managed. People think, and this has also been exposed in the comments that we have received on this webinar, that effective oversight, is the way forward. So public services are not managed well because they are public services or because the government is involved. It is also because there is a lack of efficient oversight that ought to be, transmitted into the management of those kind of services. So we should begin to hold our leaders, public health, public authorities accountable, whether in the healthcare sector, in the education sector. And this also ties back to the issue of awareness, how citizens are aware that these services are their rights and that this is what they ought to receive from government. So I think all these things are interlinked. The more citizens are educated and empowered with the knowledge of what is theirs and what should not really be sacrificed on the altar of commerce, the more they are able to seek accountability and demand that efficiency be directed towards the management of these services. So thank you so much. We've come to the end of this particular session on this webinar. So I'll just transfer the mic back to Aya to take us to the next session. Thank you.
Thank you so much, Zikora, and thank you so much to those who really inputted and contributed to this session. It was really important for us to hear your views, to hear.
Hi, Aya. Did she go out?
No? Can you hear me?
Yeah, I can see you now.
Yeah. I was saying that thank you so much, Zikora, for moderating this session, and thank you so much for those that contributed to it. It was highly important for us to hear from you. So without any further ado, I'm going to give the floor to Abi Badru. So Abi is the project coordinator of Public Services International in Nigeria, and she is going to make a presentation on the impact of austerity measures on public services in Nigeria and alternatives that she's going to present for the state to sustainably fund and provide public services. So after stating the problems, we are now diving slowly into the solutions. Over to you, Abi.
Yeah, thank you very much. I have also listened with rapt attention, but before I move further, I want to recognize the presence of the president of one of the trade union in Nigeria in the public sector, Comrade Benjamin Anthony, and also the General Secretary of OPTA, Comrade Wahid Sikiru. It's a pleasure to have you with us alongside our other teaming comrades from the health sector who are basically from the northern Nigeria on this platform. I deliberately invited most of our comrades from the primary healthcare sector because, that is where the real public who are in the rural settings are. I am also an health worker. I'm a qualified nurse midwife, and I worked in the public sector for some numbers of years before moving into the trade union to work with the nurses and midwives union in Nigeria before transiting to PSI. So I am part of this system. I understand the system, and I appreciate what Geisa did in terms of harvesting the perception of the public, the citizen on the quality of care they receive in the public healthcare sector and also in the education sector in Nigeria. Though, like you said, it may not be a complete overview of, what the citizens are saying, but I can assure you that you can easily get this kind of feedback from citizens from across the country. So having said that, I also want to say that despite, all this perception, it will also be important to also have a feel of what these public sector workers are also saying and experiencing. And that is why, for me, it's important that they are here. They can, at the end of the day, also ventilate, their perception. I want to share my screen, but I don't think I have power to share the screen anymore here. I don't know.
Let me fix it for you right now. Sorry. think you should now.
Yes, I should be able to do the same. So this is, I'm going to be speaking more on the impact of austerity measures. The thing we should all know is that the public sector
So
hello, you hear me?
Yeah, now we can hear you. We lost you for a second, but now we can hear you.
Okay.
Please go ahead.
The public sector was
Abby, perhaps it will help if you switch off your camera. I think it may help with the bandwidth. Abby, are you around? Yeah, you should be. Okay, you are muted.
I think sharing my screen is problematic. I don't understand because it keeps freezing. But I will speak to my slide.
Okay. Or?
Okay. Yeah. Can you see my slide now? Is it visible?
No.
No. Okay. So I will speak to my slide anyway. So the impact, I'm to look at the impact of austerity measures on public services in Nigeria, an alternative for the state to sustainably fund and provide public services. Like I said earlier, the public sector, especially the healthcare services, was efficient in the 70s, in the 60s, despite that, the level of technology have not even advanced to the current state. I could remember that the university teaching hospital in Ibadan, Oyo State, was standing strong and took patients for specialist care around the Western African region. But so to say that the fact remains that our governments acceded to neoliberal agendas of international financial institutions, which usher in austerity measures as we know it. The austerity measures spells, a lot of reduction of standard in policies and economic availability of funds for public sector, to our government. It's kind of prone down how much our government can actually spend on public services. The detrimental impact of austerity measures on public services in Nigeria is a pressing issue. It needs urgent action to identify and implement sustainable funding alternatives, particularly in area of healthcare, education, other infrastructure, and utility services. And having said this, what is structural adjustment? Is a term used by the IMF programs, and it refers to economic policies that aim to reduce countries' fiscal deficit and balance of payments. These policies often involve austerity measures and can significantly impact public services. It actually impacts public services. Austerity measures have significantly impacted Nigerian public services through several policies of the government, which were handed down to them by the funders, the international financial institutions like the World Bank and IMF. These policies involve around the imposing austerity measure to stabilize or decrease debt level, prevent defaults, and ensure that countries can continue to service their existing debt and access future loans. These are the beliefs of IMF. They consider maintaining inflation in low single digit crucial to achieve this. So many related measures are widely recognized as part of standard austerity package. They include social security reform, cutting down on national wage bill, labor flexibilization reforms. That is where you begin to hear about right-sizing, downsizing, reduction or elimination of social protection, flaws and safety nets for workers, strengthening private, so to say, public-private partnership, but which we understand as private-private partnership and nothing to do with the public, and privatizing the public sector own enterprises, such as we have seen with the privatization of the energy sector, especially the Nigeria Electrification Power Authority in the recent past. So all these are what the IFI, the International Financial Institution, claim that austerity measures could do. But in actual sense, in the reality of our everyday existence, we have seen reduction in funding that has resulted in budget cuts, leading to insufficient funding for essential services. This have worsened the quality and accessibility of education, healthcare, and social services. For this year, 2024 budget in Nigeria, 5% of the budget is dedicated to health. Of a country with over 200 million people, 5% of the budget is, allocated to health. And that is contrary to Abuja Declaration, which was a declaration by all the AU countries that stipulated 15%, at least minimum of 15% of the annual budget to health. And what we are seeing as the order of the day is continuous, emigration of healthcare professionals in the country. This year, more than 20,000 nurses and midwives have left the shores of the country for greener pastures abroad. This is because, the wages are not good. There is no quality in terms of working conditions and also remuneration. Everybody is looking for greener pasture. We have the slogan in Nigeria that we call the Japa syndrome, which means people are always trooping out to look for better lives. This has also impacted, the health system, because the rate of the attrition rate and retention rate of healthcare workers is very low as a result of poor wages, freeze in employment, and lowering of the national wage bill. There is job losses caused by this austerity, like I said, because of the cut in public funding. There are a lot of layoffs of public sector workers. Lagos state government retrenched more than 400 workers in the water sector recently. This is not good for, provision of accessible and water resources to citizens. Increasing unemployment and putting additional strain on social services. It's unfortunate, my brother, Mr. Martins, your experience in the teaching hospital, but one of the causes is the fact that there are fewer and fewer healthcare professionals and specialists in public hospitals. Most of them have either retired, have traveled for greener pastures, or are no longer willing, to be in that space. And government is not helping the matters by recruiting, specialists, especially those with experience. And this is also coupled with the fact that most of the equipment in the hospitals are obsolete. Government is not funding, provision of equipment that are in tandem with today's technology in most of these hospitals. And while we will not create excuse for inefficiency, but it's good for all of us to come to an understanding that the system is not working, and there are some policies that are handed down to our government that is, further increasing the inefficiency in the healthcare system. Austerity measures often disproportionately affect the poorest segment of the population who rely heavily on public services. And this can also lead to social unrest. We have had, Nigeria is full of social unrest in so many quarters. Reduced public services can lead to dissatisfaction and unrest among citizens, potentially resulting in protests and political instability. And the long-term economic impact is the fact that these short-term fiscal savings achieved through austerity will lead to a longer-term economic challenges, such as decreased consumer spending and lower economic growth. The current approach to dealing with austerity measures is both blunt and ineffective. It often damages the sectors government and international institutions claim they want to protect. So instead for these fiscal policies by the IFIs to protect the citizen, provide affordable, accessible, and available, public services to the people, it further drove those things away from the people and further caused, more problems, more complex problems. So having spoken about the impact of the austerity measures, what are the ways out? The way out are not, or the alternative to austerity for sustainable funding. Government need to move more than their rhetorics and show real change in practice by stopping pursuing austerity policies in the face of multiple crises, especially in the health, economic, and health sector, education, and all, public sector generally. Given that it is known that austerity will prolong economic recession and undermine economic recovery, the government need to recognize and maximize the public sector contribution to economic growth and development, including transformation in unpaid care work and gender equality. One key alternative to austerity is to set and act on ambitious target for progressive tax reform. By increasing the tax to GDP ratio by at least 5% by 2030 through progressive taxes, especially on wealth and corporation, Nigeria can significantly boost its revenue and fund essential public services. PSI had this campaign in Africa and especially also in Nigeria called Tax Justice, making the tax to work for the people. Nigeria is one of the top 10 countries with illicit financial flow in the world, which is, speaking to the issue of corruption and evasion of taxes. Nigeria has tax holidays for some corporate multinationals, which are in the export processing zones, EPZ zones in Nigeria. This corporate tax incentive is having its toll in the sense that monies that could have been invested by government to provide quality public services and be given as tax incentives to multinational in the name of we are promoting the inflow of businesses. Also, apart from this is import duty exemptions. Some goods have enjoying import duty exemptions, and these are not goods that are, service even the common masses. So there is need for government to harvest taxes through import duties to provide quality public services. So broadening the tax base, ensuring more individuals and businesses contribute could increase tax revenue. It could increase internally generated revenue. This include improving tax compliance and reducing evasion. Progressive taxation by implementing a more progressive tax system, prioritizing higher contributions from wealthier individuals can help address inequality and generate additional funding. This is very important to create enough internally generated revenue to service, our public services, improving, infrastructure in public services, improving, the quality of care in public services through employment of more and of more professionals, and also by recruitment. It's very important. So there is also need for debt management.
Abby, 1 minute.
I'm rounding up. Government need to support more ambitious debt cancellation and rescheduling program and support and restructure their debt so that they can prioritize investment in quality public services. So this debt restructuring is very critical. There is need for government to renegotiate with creditor to lower interest rates and extend debt repayment periods, so that they can have it can reduce pressure on fiscal pressure and increase the opportunity for government to invest in quality public services. Finally, there is need for government to prioritize sustainable borrowing, focusing on domestic rather than external borrowing to reduce vulnerability to currency fluctuation. I will stop here. Thank you.
Thank you so much, Abby. That was a very, very insightful presentation and quite holistic. Thank you for addressing all the angles of this issue. And now I'm going to give the floor to Daniel, who's going to moderate the Q&A session, because I'm sure you have, I mean, the public must have a lot of questions regarding Abby's presentation. So please, Daniel, the floor is yours.
Right. Thank you very much, Abby, and thank you for being this comprehensive under a very short time. I think the issue of austerity, as far as the region and Nigeria is concerned, has been a very big one, mostly perpetrated by the International Monetary Fund, the IMF. But I think that on issues of austerity, you sum it up in a few lines, that austerity measures driven by the International Monetary Fund, the IMF, stifles investment in public services, undermine rights to basic services such as healthcare. It suppresses economic growth and entrenches poverty and inequality. And so what you have basically underscored is that as a country, and here I mean Nigeria, there's need for the country to look at alternatives. And one of them is revenue mobilization, which I'm glad that you mentioned the need to cut down on unnecessary tax incentives and put in the necessary measures to raise revenue as much as possible domestically. So what I would do at this moment is to allow for as many questions as possible. I say many very moderately. It does not mean that all of us, because we are really working under what someone will refer to as treated time, very short, but we are committed to gaining a lot from you. So please, the floor is open for questions, for comments. Make your questions and your comment very straightforward, direct, and simple. Thank you very much. So the floor is open, comrades. Do we have a hand already? So whilst we wait, let me see if there are comments. Okay, so there's a comment was shared by Taiwo. He says that to my own perception, I hope this hasn't been read already. It hasn't already been read. To my own perception of public service, the rate of sustainability is poor. Sustainability is poor and need to be addressed and reshaped. Also, the services are not accessible to all mass in both education and health sector. No good implementation of projects such as free education, free drugs, free maternity care, so as to reduce the rate of maternal mortality and morbidity in our locality, because the life of our community that we work in, just a minute, that we work in are at risk if no funding and accountability. There will be poor quality service. Thanks for your time and marvelous presentation. Thank you very much, Taiwo. Yes. Let me see. Are there hands already raised?
No. Please don't
Not
feel
yet.
shy. We want to hear
Don't
from
be
you.
shy, comrades. You are a lot here, and I'm sure Abby's presentation was very comprehensive and easy to understand enough. So we expect more comment and questions from you.
There's
Okay,
a
so Atat, Charles, please go ahead.
All right, thank you so much. Can you hear me firstly?
Yes.
Okay, good morning. Thank you so much. Abby's presentation was very insightful and very detailed and deep. And I guess because she's within the system. My question is strictly just going to be directed to her. In terms of community accountability, in all these conversations, we've heard about accountability from the parts of government. Can she give some sort of suggestions or start process for community accountability? Because a lot of times you have the funding, you have the structure, but the saboteur is within the system. So you go to a healthcare service to access healthcare, they have been provisioned for drugs, but the people within the system have diverted those drugs for personal uses. I use a perfect example from an experience that I had in River State in Nigeria. We went to a primary healthcare center that is meant to be operating 24 hours. And there's a building, a 2-bedroom, provided for, I think it was a midwife within the facility. Guess what? We went there around 7 p.m. The accommodation had been sub-rented to somebody that is not even in the medical profession. So how do we engage community accountability as citizens? That's the question.
Thank you very much, Charles. Let's see if there are questions or comments. Then I would give the chance to Abby to respond. There's another question from Ahmad. He says, my question to Abby is that which method and methodology did the PSI and other relevant union following to notify the governments and policymakers and advocate them on the need to change the need to change. Yes. So it boils down to the question of accountability, but this time around is looking at the policymakers level. So Charles' question was around community accountability. And the other question is looking at, the policymakers, and that is coming from Ahmad Shehu. Yes, thank you very much. Okay, Abby, so if you have time, kindly respond to the two issues. One around the issue of community accountability, and then the other about ensuring that policymakers, i.e. government and other experts, are also one, held accountable, but also given the opportunities for proper monitoring of the policies they have initiated. So please go ahead, Abby.
Okay. There is no hard and fast rule about community accountability, but it's something that we can work ourselves around, because it's everybody's work, to hold any public office holder accountable. When I say public holders, including public sector workers, it's our duty to hold everybody accountable. But I want to say, in terms of professional misconduct, most of these, virtually all the professional groups in the health sector, for instance, have professional body, that they have punitive measures. It's a matter of reporting, if it's a doctor, you can report the person to Medical and Dental Council of Nigeria, because if it's a nurse, you can report the person to Nursing and Midwifery Council. If it's a community health worker, they have Community Health Workers Council. If it's a professional misconduct, you can report to their council. You can report to the state commissioner for health. You can even report to the local government where they work. The local government council where they work. So all these are ways of, reporting and holding accountable. And as you report, civil societies are also very good, in terms of propagating those reporting, in terms of giving voice to the voiceless, to the, individual citizens, escalating the issue so that it gets the needed attention. So it's our joint responsibility to hold each other responsible for, efficiency in our system, to hold each other responsible for doing our bit. But that said, most often, I used to say this to, healthcare workers. When I worked in a rural facility, and we'll be just two in a whole district hospital to run the night shift. We will have patients in the male ward, in the female ward, in the maternity ward, and we'll have women in active labor. And you are just two people, and there is no electricity, neither is there efficient water supply. This puts a lot of strain on you as an health worker. And if care is not taken, you wouldn't even know when you will snap as somebody who have the least, who need the least of your attention, because you are already burdened with delivering, care to people who are in urgent need. So all these are things that communities, healthcare workers, and the general public need to sit, to address, to confront, and see that we are partners in progress. And we need to act with a one voice in, telling the government the promises you gave while you are campaigning, you are not fulfilling them. We need to speak with one voice, both the communities and also the public sector workers. So we need to be on the same side while we look at solutions for all these problems. So in terms of policy engagement, I think this is one area that PSI have been, working effectively with public sector unions in all over the world, and most especially in Nigeria, in terms of capacity building on all these international policies that is having direct impact on the national government and the policy in terms of public services in our countries. So we know the fact that IMF is imposing austerity measures, and there are some agreements that our government is going to sign, and we begin to demand for transparency in all those processes. And we can only do this when we are aware. So what PSI does is, build capacity of the leaders in the union to be aware of these policies, to know the quarters where they can seek for question, and also to engage even from the inception in some of these policies. And this has, proven, to be worth the while. There are so many policies that could have been detrimental to the, the public services, that if not for the intervention of trade unions in Nigeria, it could have, been otherwise a bad policy decision for government. So
thank you very much, Abby.
yeah.
There are some more questions. Hold on, let me get,
Okay.
there are some more questions. Okay, so there's a question on, hold on, let me. Okay, so there's a question from Abdul Kader who says that, how do PSI create awareness to the masses for the benefit of their rights to public service? So creating the awareness about, to citizens about their right to public service. There is also a question from, hold on, let me see. There was a question I earlier captured where one is asking about the security. Yes, so one from Enoch. Enoch says that the government needs to strengthen security to help the staff to work effectively. So Enoch's point is about ensuring that, and this one boils down to issues of occupational healthy and safe, or occupational healthy and safe. The fact that these nurses sometimes work in very difficult situations, especially in areas where there are conflicts, including areas where there may not be conflict, but those healthcare facilities are situated in communities that are far from town. So his point is about, beyond what we are advocating for, is to also consider the need to recommend the security and safety of healthcare workers. Thank you very much, comrades. Let me see if there are. Okay, so there's another comment. In fact, there are many comments commending your presentation on how beautiful and how comprehensive it is. So I'm only taking note of the question. So there is also Jamila Sidi, who says that we need the government to recruit more, to empower, recruit more manpower so that we can reduce the workload in our workplaces. Thank you very much. But I think that what we also need to understand is that leaders by themselves, whether politicians or public sector officers, do not do good because they are good people. No, we are not good people. People do good because there is accountability. And this accountability is being demanded by the citizens. There are certain Chinese workers who are operating in Africa. The kind of malfeasance they engage in, they can never think of them in China. No, you dare not. You will lose your life. Your family members will also lose their lives. However, when they are in Africa, they do that with impunity. There are certain corrupt activities that European investors can never think of whilst operating in Europe or whilst operating in the US or Canada. But when they are here, they engage in all kinds of kickbacks. They call it lobby. But they engage in all kinds of activities. They can't do it where they come from because citizens will account and they will demand for your head if you misbehave. Here, we have mixed the need for people to account. We have mixed it with religion. We have mixed it with culture. We have mixed it with all kinds of things. So we are highly unstable when it comes to demanding for accountability and probity in our context because we have mixed too many things up. And so whilst pushing for all these things, I thought that I should bring this to our understanding. Comrade Wahid, I see you. Thank you very much to all the trade union leaders who have joined this wonderful call. We know you are busy, but you have taken time to participate. Thank you very much. If there are no more questions coming by way of hand or through the comments, Abi, kindly provide your final comments, then we'll move on to the next session.
So how PSI creates awareness to citizens? PSI creates awareness through their affiliates in our countries. And this is one of those kind of awareness creation. And we, like I said earlier, we build capacity of the union members, and we also engage with communities.
Abi, sorry. Enoch, I read your comments. I read it very, very well. Your comment about security, unless there are other comments you raised, but I read your comments very well. Thank you. Abi, go ahead.
Okay.
Yeah.
All right. So we continue to advocate through our affiliates in our countries, especially for this course in Nigeria. We are very close to the citizen because we hold several town hall meetings and community engagement, you know, in our field where we are having projects, and we have done this. And PSI is not only, you know, engaging on issue of union alone. We are very, very vocal when it comes to issue of internal migration, internal displacement also in Nigeria. We have a whole project that has been spanning for 5-6 years, and we have developed a fact sheet. We also had a project, a research project on that, which states recommendation on how to improve security situation and ensure quality public services. I am not very far from Comrade Enoch question on security. We were together in Kaduna State, and we visited one of the community healthcare community healthcare facility. And we were told that we should be watchful because very close to that facility is where some hoodlums hibernate during the day, and they commit a lot of atrocities during the night. So if you are working in that kind of facility, how do you give your best when 50% of you is singing, "I am insecure in this environment"? So I fully understand. And one of the recommendations we are pushing to government of Kaduna State is to ensure safety. So many health workers have been kidnapped in Kaduna State. Some of them lost their lives in the process. So we are advocating for safety of healthcare workers in the course of delivering their, services within the healthcare facilities. Also, in terms of recruitment, we cannot say this enough when it comes to need for government to put more emphasis, to make it a point of duty to recruit more healthcare workers, more teachers in our public facilities. This is very important in the sense that, like I said, Our comrades are moving for greener pastures in droves. The owner of a teaching hospital may not have more than 3 cardiologists. If a whole teaching hospital have 3 cardiologists, what is the hope for an health center? What is the hope for, a primary healthcare center, which means, or even a secondary healthcare center, which means the hope is slim. So for my brother that said that there are only, house officers or training doctors in the hospital, it's because those who are in the middle cadre of that sector are gone. They are they are not in the country. And to say that one of the best behaved healthcare professionals around the world are Nigerian doctors and nurses when they are abroad. But when they are in, they are the ones that are snapping, and it's because they are burdened with the workload. It's because they have fewer people to attend to numerous people, and there are no equipment to even make the work easier, and the remuneration is not even giving them the best of, morale when it comes to what they have to do. So all these are cross-cutting issues, and we will continue to engage government to employ more. Now we are producing more in terms of community health workers, in terms of nurses, midwives. The country is producing more. The country recently, the government recently put a migration policy for healthcare workers. This year, our government signed a national policy for migration of healthcare workers. But what they are trying to do is look for how to export. Export more healthcare workers, not to addressing the current situation in our country. And this is something that all of us must come together to engage and also to advocate for more incentive, more remuneration, more quality workspaces for healthcare workers, for education, for public sector workers as a whole, so that they can give their best in terms of rendering their services to the citizens. I think I will stop here.
Thank you very much,
Daniel,
Abby.
you have answered the question on accountability very well.
Thank you very much. So I'll read 2 comments and then I'll pass on to Aya. So there's one from Pius who says that well done, Abby, for the wonderful presentation, and thanks for mentioning the case of the sacked workers of Lagos State Water Corporation. Well, so it is sad to know that their payoff was grossly inadequate all owing to the IMF policy. There's one from Salah Taiwo who says that most of the primary healthcare workers, just a minute. Most of the primary healthcare workers lack good infrastructure, functioning equipment to carry out their services. In a nutshell, and then this is coming from, hold on. Just a minute. Let me read these comments. Yeah. So I think those are some of the comments. So generally, I think my final comment is that, look, it is a all hands on deck approach. Unions must be well organized. Civil society organizations must be well organized. All other groups must be well organized. And we must all come together to seek for what the kind of public service we are looking for. Whether we are demanding for revenues to be collected to invest in public services, whether we are demanding for more people to be employed, whether we are demanding for equipment, whatever we are demanding, we need, as all stakeholders, kind of discussion and an approach to address them. We can't leave public sector policies to just government and politicians alone. We all need to be involved, right from issues of recruitment, wages, investment in public services, and every other aspect. We all need to be involved. And I think that if we approach it that way, it becomes easier, and it shows that we are also committed to a democratic process. There's nowhere in the world where democracy thrives, where citizens are laid back and they are not committed to speak. whether it's about the government they voted for or the government they voted against. We must all commit ourselves to demanding what is right. And one of them is to ensure that we are all demanding for investment in quality public services. That will contribute to shaping the narrative within Nigeria, and that will contribute to shaping the narrative and understanding within the region. So without much ado, I'll hand over to Aya to continue the next session. Thank you very much.
Thank you so much, Abby and Daniel. Thank you so much, Daniel, for setting the tone, because actually we are right into this session, which is about all of us formulating recommendations for a way forward. So how do we build a people-driven momentum for the sustainable financing of and provision of public services in Nigeria? So what I want to is to hear from you about what exactly, as citizens, because I hope you've understood that you should not leave the business or the public service sector only to politicians for them to decide how they want to provide and fund them. You also have a say in the way these public services should be delivered so that you have an equal access to those services. So based on that, I really urging you to formulate some recommendations that can be taken up from the people and escalated to decision makers so that there is the public services that we want, actually. So any idea, any recommendation? I'm really eager to hear from the floor. So we've understood that it is important to sustainably finance public services. We've understood that there are things in the public sector that need to be fixed and the root causes of the issues need to be addressed. So what do you think is the role that you can play as citizens to ensure that you get to see the public services that you want and you need? Don't be shy. So perhaps to give a bit more context, at the moment, Nigeria is going through a fiscal reform, like a very comprehensive and deep fiscal reform at the moment, where I think from my understanding of the reform so far is that the proposal is around making sure that there is better tax compliance and that the tax burden shift a little bit from vulnerable groups to those who have who can afford to pay taxes. That's what we call progressive taxation, so that those who don't have a lot, those who are vulnerable, pay less, and those who have more money pay their fair share of taxes. And those who don't even deserve tax incentives or tax holidays get to also pay their fair share of taxes, such as multinational corporations. So how do you see this current reform, and how do you think you can be an actor of this reform so that the revenue that is supposed and meant to be generated out of the fiscal reform can help fund public services? What is the role that as a citizen you believe you can play? Anybody has some ideas? Okay, I should repeat the question. So here we are at the moment where we want to formulate recommendations, okay, for the sustainable financing and provision of public services in Nigeria. And we want these recommendations to come from you, the people, because you are the one experiencing those public services on the ground. So how can you play a role in pushing a government or policy makers to provide and sustainably finance quality public services so that you have access to the quality public services that you need and that you deserve, as well as your families. If you, simply put. Anybody? Don't be shy. Don't be shy. Yes, Benjamin Anthony. Please go ahead.
Good morning. Comrades, good morning.
Good morning.
Well,
Good morning, Comrade President.
yes, on the issue of quality finance, to me, as a person who have been working in the field. Hello? Please, some of you should mute your distant, your phone, your microphone, please. To me, finance, yes, it's a problem, but it's not a major problem. For us to have a quality public service is to ensure that the government have the political will to ensure that the public utilities are being in place and even getting qualified people to hate, because the major thing is those who hate those public services. Because you will discover, like in Nigeria, you go and pick a less qualified person and put him to be a CMD or a DG of the public sector. And the man will come be there with less qualification, inefficiency. He will there, because he's a boss, he will there bulldozing everywhere. So, and at the end of the day, even if they push finance there, corruption again in the highest level will not allow the public sector to function. Like now, if they send, okay, let us send money to a certain hospital for renovation. I'm telling you, they will do shabby work. And maybe half of the money or 75% of the money will be diverted, even in buying equipments to work. They prefer to, they don't even want, they will go and buy refurbished equipments. So to me, I look at it, yes, we need to finance them, but we have to tackle some of these serious problems that stand in a way to even spend the finances well. But we want to, I want to say, government need to improve on the budgets, budgetary allocations to the public service needed to be improved. You will discover a whole budget of a country like Nigeria, the whole thing for education or Medicare will be like 5% of the whole total budget. And when you go to other minorities even feeding in the villa, you discover you have a humongous amount of money there than the money that the medical centers or federal medical centers and other federal institutions will be spent on. You discover that in the whole total federal universities, they will go and maybe give them 0.05% of the budget. So, and we will not go anywhere with this kind of financing or finance of our public sector. as the first speaker.
So
okay.
Thank you so much, Benjamin. The point has been really taken. So what you highlight is the need for transparency and accountability, because even if we boost domestic resource mobilization, the money can still be lost through corruption loophole. And this is a note very well taken. Thank you so much for sharing your insight, Anthony. I would read
an increase budgetary allocation.
Budgetary allocation, yeah. Thank you so much. Thank you so much. I will read Zikora's comment, then I'll move to Wade. So Zikora said, I think we need to actively redefine public discourse to challenge prevailing neoliberal narratives that prioritize market logic over human needs by utilizing public campaigns and media engagements to emphasize how these services impact people's dignity and collective well-being. Much has been done to alter the minds of people on how they should perceive public services and the argument for its commodification. So thank you so much, Zikora, for sharing this. Waid, I can hear from you.
Yeah, thank you very much. Are you hearing me now? Can you hear me?
Yes, please.
Okay, thank you very much. I think for me, improving or having a quality service is a two-way channel. It is on the part of the government and at the same time on the part of the citizens. There are a lot of things that government need to do to put in place for us to be able to have this very good quality service. Like now, I can see in Nigeria, for instance, they try to put up what they call Servicom. And Servicom is expected to come about a good quality service from all the public service. But they have not been able to achieve. Hello?
Sorry,
what is this?
Lord, can someone help me mute these people?
Interruption, I can see. Okay,
thank you so
is the
much.
interruption over?
Thank you so much. Whoever stopped. Yeah, please go ahead.
Sorry?
Wait.
I'm saying interruption is over, right? Okay.
Yes, please.
Okay. My feeling on this is that government need to invest much on training and building capacity of the workers in the public service. Because if you look at what is happening generally now, the issue of training has gone down the drum within the public service. And a lot of people that are working does not even know what it is to have a good quality service. For somebody who is expected to promote public service good and does not even know what it entails. So you are not building their capacity. The training is not going on anywhere within the federal government. You are not doing anything that is happening. So you need to build a very quality public service. And good quality public service cannot be built without training and also building their capacity for them to understand what this is all about. You see, some need to understand what is the service standard. The government need to establish what they call establish a government digital service that will give us what we call a service standard. This service standard is supposed to be what people should kill with. We understand the level of corruption that we have in society, but I still believe so much that with much training, with much education, and with much people getting involved, both at the higher and the lower cadre, you know that there will be an improvement. So that good service looks like and how such service can be delivered. This is my short intervention. Thank you very much.
Thank you so much, Waid, for this insightful contribution. I would read the comments. So we have from Ogunlade, ideally, sorry, can someone help? Okay, I have to. I need to mute these people.
Can you take a please stop interrupting this thing?
Oh, and they keep on opening. This is great. Okay, this is what I'll do. Hold on a minute.
Please, you can Send them out of the
Yeah,
meeting.
that's what I'm trying. Actually, that's what I'm going
Take
to
the
do.
person out now.
Yeah, I'll send them out. Okay. I think they are gone now. Ooh, okay. Thank you so much. Let me continue reading the comments. So Ogunlade, ideally, government policies plans should convey the expectations of the collective and not the wish of a few. Improved public service will largely depend on the quality of dialogue and interactions that exist between states, policymakers, and non-state actors, beneficiaries. We should ensure that these interactions are formalized and dialogue institutionalized. Compliance or otherwise to the outcomes of the dialogues interactions should inform and reasonably influence our leadership recruitment. Another comment from Taiwo, there's a need to address functional equipment in the facility, potable water in our facilities, improve services in our community. Okay, that's Jamila Sidi, right, rather. Faiza Musa, inadequate funding. Primary healthcare often lacks sufficient funding, leading to shortage of equipment, medicine, equipment, and staff. Zuleya Aminu said, oh, sorry, no problem. Thanks for joining. Nas from Kano State said there is also the need to make an advocacy visit to philanthropists, not only relying on governmental organizations. And okay, that's now Ahmad Shehu. To my own view, it's the trade unions who should continue to create enough capacity building at the grassroots and harmonizing the need of citizens to raise the voice towards providing adequate policy that will enable them to enjoy quality public services by themselves. As recently, PSI has organized capacity building in Kano State. Such kind of capacity building should be advocated for and conducted by other trade unions at various states and local communities in order to have a global and collaborative voice to provide a policy that will support quality public services. Thank you so much for these very insightful comments. I think also something interesting that I will share from I'm from Ivory Coast, so from the Ivorian perspective is that we conducted some participatory action research on access to healthcare in a community in Ivory Coast. And honestly, the same findings were found there as well, you know. Issues around some fees that are paid and not necessarily accounted for, the way patients are treated, etc. And as a result, we use the findings of that research to engage with policymakers, but also with health authorities and healthcare workers. And what happened is that there is a monitoring committee, because monitoring was an issue. A monitoring committee was set up in that particular community, and that monitoring committee is made of policymakers, but also community members to monitor how healthcare is delivered and to highlight potential violations in the way this healthcare healthcare services are delivered, so that these issues can be addressed. And at the same time, a way to restore the dialogue between healthcare workers and also patients. So that's an example that I can give in terms of what we did in Ivory Coast. And also what I gather for all your reactions is that, of course, it is important to adequately fund public services. I think we all reach the consensus that it is important. And even using this current fiscal reform to increase the size of the budget, not only the share of the budget allocated to education and healthcare and other public services, but also the overall size of the budget. And to do that, we have to fight illicit financial flows. We have to fight corruption, tax evasion, and wasteful tax incentives as well. Once the size of the overall budget is increased, of course, we have to increase the share of the budget to be allocated to education and healthcare and so on. And make sure there is scrutiny in the way this money is dispersed so that there is no further corruption. And of course, looking into, Taiwo, could you please mute yourself? There's so many Taiwos here. Daniel, I made you co-host. If you could help me.
Okay, so I'll do that. Yes,
yeah,
thank you.
I think you're welcome. So where I was is that not only is it important to increase the size of the overall budget, but also the share, and also increase scrutiny. Make sure that the citizens' public participation and accountability, transparency is part of the process so that everybody sees how the money is going to be dispersed. That's very important. And I think concretely, you have, as Nigerians, to engage with the tax reform, the ongoing tax reform process at the moment. It is very important. I see a lot of outreach from the Fiscal Reform Committee that is spearheaded by, I think, Mr. Taiwo Oyodele. And I think it is time that you engage in that process and say that we see that we are making efforts for the tax reform to generate much more revenue in a progressive manner, hopefully. But you have to remember that the money or the extra revenue you want to generate through that tax reform has to be channeled towards essential services in a way that is transparent and accountable. So that's something concrete, perhaps, that you as Nigerians, as right holders, as the people who should have access to quality public services in your country, can do concretely to engage with policymakers so as to achieve quality public services. So I'll stop here, and then finally hand over the floor to Abby so that she provides closing remarks.
Well, I believe that you have successfully rounded off by highlighting all the recommendations. I want to just do vote of thanks in terms of rounding up, and also to emphasize the fact that we have a collective task ahead in terms of advocacy, in terms of engagement with government and all critical stakeholders when it comes to investment into the public sector in Nigeria. I want to appreciate all of you that have made time to participate in this Monday morning engagement. It has been worth the while. We have learned, we have engaged, we have discussed, and we have some very, very valuable recommendations that we hope to push in the coming year. I wish all of you happy holidays ahead and a successful new year. Thank you very much, Aya, for putting this together. We appreciate you, and PSI is poised to work further with GI-ESCR. I want to also appreciate Kappa, our long-standing. Please, can you mute the speaker?
Yeah, please.
We want to appreciate Kappa, our long-standing comrades. We have enjoyed a lot of, comradeship from Kappa over the years, working together on water justice and water privatization campaign in Nigeria. We hope we can also push this further. Thank you very much. I want to commend all our comrades, our comrade president of OPTA and the comrade general secretary for making our time to also engage and also contribute in these discussions today. I also want to thank our comrades from Kaduna, from Kano, from Abuja, who have also been part and parcel of this meeting. Thank you all. And also Borno. Yeah, we have people as far as Borno State joining this conversation today. So thank all of you. I wish us a wonderful rest of the day and week. Thank you very much.
Thank you very much. Thank you. Thank you.
So bye is it from now for now?
Yes.
Thank you. Yeah, bye.
Bye.